Joining me in our studios is a public health physician, Dr. Toni Adeyemi. Good evening. Thank you for being with us.
Good evening. Thank you for having me.
It's not really cheery news for healthcare professionals. The Minister of Health today admitted that more than 40 of our health personnel have tested positive. Now, is this a failure to adhere to infection prevention control protocol, or is it that the virus is just that virulent?
Well, the virus is actually highly infectious. There's a difference between infectious and infectivity and virulence. Infectious is the ability for it to transmit from one person to another easily. Pathogenicity, the ability for it to cause disease, and virulence for it to cause death. So it's actually a very infectious virus, which we are aware of. Right. Also, we have infection prevention and control protocols in place. However, this has not, because we do not have a national response system, there are some states that are not being carried along appropriately with some of these protocol measures. So the protocols exist. NCDC has developed infection prevention and control measures in which even the Nigerian Primary Healthcare Development Agency, they have some for their primary healthcare centers, which everybody is meant to follow. However, some of the things in the protocol, which include things like observing standard precautions, use of personal protective equipment, have been inhibited because we do not have enough personal protective equipment. Also, we have to there has to be rational use of these PPEs. So some of these things have not been well tailored down such that the private sector is involved, because there has to be a lot of private sector involvement. Some of these cases we're having are actually from the private sector. So there needs to be more engagement with this private sector to ensure that all protocols are duly adhered to and the provision to actually adhere to these protocols are actually put in place.
Now, we're talking about the harmony of response between federal and states. For example, in the case of the healthcare personnel that you mentioned, and the fact that some are better than others, so it's not uniform. In the same way, now it's been proposed that the country, particularly for interstate travel, be locked down for 2 weeks. Is this in line with what you think should be done now? Will this help with the cause
certainly. Certainly, it would help because, for a fact, we know that Lagos is a bit ahead with the response management and the way they are actually responding to things right now. And because we didn't have a national lockdown, you might find out that some states actually have been able to contain the virus to a certain degree or a certain extent. However, if you now have travel, because this virus travels through humans. So if you now have a situation whereby you have a good containment measure in place and you're treating your cases well, what you have is an influx of more cases. Anytime anybody is suspected to have COVID, they try and find their way to Lagos, thinking that they might get better care at any of the isolation centers in Lagos State. So an interstate lockdown would actually go a long way in helping states actually contain the virus in their own locality and come up with local measures, because a measure that we might adopt in the south might be different from what they might adopt in the north, what would actually work or be effective there. So the interstate lockdown, I think it's a good one.
Is it cause for celebration that there are still some states that have no case of COVID-19?
No, it's not time to celebrate yet, because there are so many levels to this pandemic. So states that do not have any case yet, it might actually even mean that they are not testing yet, because we know that there's a global shortage of even reagents. So these reagents are disbursed according to on a need-to basis. So it depends on states that actually need or have a lot of cases that have more reagents. So states that do not have cases right now, what they should be doing is adequate preparation. They should prepare for the epidemic as though it's coming tomorrow. So they should have isolation centers in place. They should have testing centers in place. They should begin to educate their community, engage community members such that they understand. Because community members might tend to feel that after all, we don't have a case, why are we locked down? Why are we at home? Not forgetting that the lockdown is not to stop the virus, but it's to give healthcare authorities adequate time to come up with a strategy such that by the time we're reversing this lockdown, even as we're having more cases, we're able to contain it. So states that do not have this should have an emergency operations center in place. They should start planning, meeting regularly, and come up with measures that can mitigate when when the virus actually comes to their states.
Community transmission now seems to be well established, because the percentage of cases that are now imported has dropped drastically from what we had previously.
Yes.
Given the situation as we have it now, with what is going on, the second phase of the lockdown in Lagos, Ogun, and Abuja will end on Monday. If this governor's proposal for interstate travel sails through, that does not mean that there won't be movement within the states.
Yeah.
How difficult does this make the case surveillance that is already ongoing in places like Lagos, as well as the check with the communities to actively look for people and test them?
Initially, before COVID, we had like an active surveillance plan, which was already going on for polio. Polio is one of the diseases that we're trying to eradicate out of Nigeria, and we're in the final stage. So there's an active surveillance model which is in place, and we didn't have to lock down to continue the active surveillance case, although polio is not, the prevalence is not as much as for what we have now with coronavirus infection. So with a good active surveillance plan in place, empowering our disease surveillance notification officers, it will be easy, not that it will be totally easy, but it's still manageable to track down contacts of cases, even if the lockdown is reversed and everybody has to go back to work. Getting proper data, involving community members, because we need community informants to actually track down some of these cases. Unfortunately or fortunately, these cases, some of them are actually asymptomatic, so they do not present with any sign and symptom. That's why the community testing, decentralizing testing, and having sites where you can collect samples such that testing is easier or closer to the people is a good strategy, such that we are still testing. Whatever happens after the lockdown, after Monday, we don't know if we're going to continue the lockdown or if we're going back to work, but whatever happens, we're testing. There's modalities for testing. We have protocols in place. We have communities can come up and rally around and say we can have a quarantine bay or something, because the main issue, our major public health strategy right now is the social distancing. But because of the peculiarity of Lagos, Nigeria, overcrowding, it's a bit difficult for communities or a man in a 10 people living in his house and you tell him to go and self-isolate because he has had contact with a case. So communities can come around and say maybe a primary health care center, we can quarantine you there while you're waiting for your results or something. So we need to think outside the box and come up with local strategies to be able to solve this problem.
All right, then. Thank you very much, Dr. Toni Adeyemi. It's been a pleasure speaking with you.
Thank you for having me.
Thank you for joining us at this time.
Thank you.